Welcome to our first session of Ask Your Pediatrician. I'm going to address a question today that I get quite a lot, and that is it okay for my baby to sleep in my bed with me? What you really need to know about sleep safety is what we're trying to prevent basically is SIDS, sudden infant death syndrome. This is a tragic situation where an otherwise healthy child dies in their sleep. This is something a new parent obviously you want to avoid. We've had a huge decrease in SIDS, sudden infant death syndrome, by having babies sleep on their backs or back to sleep program that's been instituted in this country over the last couple decades. However, in addition to having your baby sleep on their back, it's very important that they be on a firm surface. So I think the issue isn't so much can they be in bed with you, but can you make your bed safe? A couple things are necessary for this. You need a firm surface. They now sell, I know, co-sleepers that are fit right in your bed so that your baby has their own space within your bed on a firm surface, and that's totally fine. They also have co-sleepers, little bassinets, if you will, that saddle up next to the bed, so it's just as if your baby is with you, but they're actually right beside you and not in bed with you. The advantage of that is, I don't know if some of you are deep sleepers. I was that way, and so when my own babies were that tiny, my wife was breastfeeding and trying to do the co-sleeping thing, I didn't feel real comfortable having them right next to me. What if I rolled over and I was really a deep sleeper? So for that reason, I prefer the co-sleepers where your infant is saddled up next to your bed. But if you can make it safe with a firm surface, maybe between the parents, that would certainly be fine. Imagine taking a newborn, putting them to sleep face down on a beanbag. Now that beanbag is going to smother their nose and that baby's going to suffocate. That's clearly what we don't want. So some of us, as I've aged, I've gotten a little more soft, and I would have to be cautious. Let's say I was having my baby sleep on my chest. Many of you have realized sometimes the babies seem happier when they're laying down on your chest. Well, if you're soft like I am, or some moms, obviously you're nursing and you've got softer areas that could potentially smother a baby, you've got to keep that in mind also. If you're awake, obviously your baby can be asleep on your chest. Other cultures, you're on a mat on the floor, certainly that would be safe. There's no soft smothering situation in play at that point. So I hope that's helpful with regards to co-sleeping and sleeping in the bed. At this point I'm just addressing infants. Obviously there's a whole different episode we need to have about co-sleeping with older infants, sleep problems with older infants, and how to avoid those. So we'll bring that topic up in the very near future. Thank you so much for listening. This is Dr. Paul, and remember, I'm your pediatrician.